Thank you, Mayor. Thank you, Chair Cox. If you're an individual out there and you're concerned about your public health because of the dangers posed by coronavirus, you don't care who it is that can help you, whether it's the city or the county or the state. And the reality is we don't care either, which is why in every step of our response to this pandemic outbreak, we have been working together. And I want to commend the mayor and the city council and the entire board of supervisors for really understanding and taking to heart the reality that we are one region that has one need, which is how do we protect the most lives possible. From the very outset of this, we have been in daily communication. I can say I talk to the mayor every day, multiple times a day, and we've worked together, whether it was getting hand washing stations up out of the gate, whether it was putting public health nurses in shelters, whether it was coordinating and collaborating and working together on the efforts around the convention center, every step of the way and every day, San Diegans should take pride and comfort in knowing that our jurisdictions are aligned with one mission and one purpose, and we are working seamlessly together. But this isn't, the coronavirus is not the first time in which we've seen this collaboration. This collaboration existed when we worked together on our syringe service policies. It existed when we worked together to bring substance abuse treatment to the county psychiatric hospital in the Midway District, a very first for our region. It existed when we've worked together on issues surrounding behavioral health and tackling the homeless. And so the Behavioral Health Impact Fund is another step in this spirit of collaboration and cooperation. And I appreciate it was months ago when I approached the mayor about the reality that the city and county had this $25 million tied up in lawsuits that have been tied up for years and was likely to continue to be tied up for years. And the realization hit me that if the county had the money, well, we ought to put it towards behavioral health services, drug treatment, mental health services with an accompanying bed in a residential setting, because that is one of the greatest needs our region faces. And if the city had the money, well, that probably would be what they would use it for. And so why don't we stop the lawsuits and why don't we stop arguing about it? And let's just come to an agreement that $25 million can be put on the street immediately to go to any of our service providers who have the ability to buy a building, acquire a building, renovate a building, expand a building, and they have ongoing revenue streams to provide services. And so this is an innovative and creative approach to immediately and very quickly raise our regional capacity to provide these needed services. There's also an additional opportunity in front of us, which is the opportunity to potentially acquire motels that are looking at the reality of having no guests for the foreseeable future and are questioning at what point the economy may come back to the same level where they may be back to a high level of occupancy. A lot of those entities might be willing to sell that entity for a one-time cash payment, and we can take that opportunity to convert those into centers of restoration, of healing, of care in a way that really increases our regional collaboration and our regional capacity. And that works hand in hand with what's happening at the convention center. The ability to get this money on the street, $25 million, to get it deployed, could potentially be opening doors to individuals who are presently in the convention center because we want the convention center business to come back, and we know that it will. And we want those individuals to have more options for where they can go in a more sustainable way. And so I really appreciate Chairman Cox's support of this. I appreciate the mayor's leadership on getting this through the city. And I think that this patient-centered approach to providing not only the services but the care coordination and everything else that goes into it is a great testament to what can happen when jurisdictions are willing to work together, are willing to resolve years-long disputes and say, let's focus on the greater good. And I'll just say I'm incredibly pleased that here in San Diego we are doing that. We're doing that when it comes to homeless. We're doing that when it comes to behavioral health. And we are definitely doing that when it comes to responding to the challenges of coronavirus. And our region will be better because of it. Thank you.